In this little recording, we're going to look at your next topic, which is physiological strategies to enhance performance, which is a pretty short topic and really just looks at the notion of using effective recovery strategies to make sure you're recovering efficiently between training sessions, between events and training sessions, with that whole idea that the quicker you recover, the quicker your body is once again fit and ready to perform. So we're going to look at a few different strategies. Going to look at some hydrotherapies, going to look at compression garments, use of hyperbaric oxygen chambers, just have a chat about sleep and resting, and also massage. So first therapy we're going to look at is hydrotherapy, which is a bit of an overarching category, and that includes anything that involves water as part of the recovery process. So we break that down a bit further into contrast water therapy, cryotherapy, thermotherapy, and pool or beach sessions. Contrast water therapy is when you immerse your body in hot water followed by cold water, back into hot water, back into cold water, etc., etc. So you keep alternating, you're contrasting the temperature of the water. So you can do it a couple of ways. You can either do like full immersion of the part of your body that you're trying to treat, or if you don't have access to a spa and a plunge pool where you can actually get that sort of immersion, you could do it in the shower. So typical process, if you're at a facility that actually has a plunge pool and a spa on offer, you would be jumping in. So firstly, you'd have a shower, make sure you're clean. Then you would jump into the spa first for about 2 minutes, which would be a nice balmy temperature of about 38 to 39 degrees Celsius. So it'd be a pretty enjoyable 2 minutes. Straight after that 2 minutes though, you're going to jump into a plunge pool for a minute. That has a temperature of about 12 to 14 degrees Celsius, which is pretty chilly. So following a minute in there, back into the spa for another 2 minutes, back into the plunge for another minute, and you make sure you've repeated it about 4 to 5 times. If you don't have access to that sort of facility, you can do a similar thing in the shower. If you do it in the shower, you're pretty much going 30 to 60 seconds warm to hot water, so probably as hot as you can handle without burning yourself. So 30 to 60 seconds in there, followed by 30 to 60 seconds at cold water, and repeat that about 5 times as well. We do say though, where possible, it is better to do the actual immersion type therapy, because then you're placing a hydrostatic pressure on the body as well, which sort of acts a bit like a compression garment in a way, which increases recovery in its own right. So contrast water therapy, why would you bother? Essentially what you're doing is you're increasing blood flow. So for your muscles to recover, they need oxygen and nutrients, and they need to get rid of waste products. And as you guys would fully appreciate now, if you can increase blood flow to and from the working muscles, you're obviously going to increase supply of oxygen, fuels, and you're going to increase removal of waste products. So the way it does it is when you're in the warm water, it's causing your blood vessels to dilate. Then when you're in the cold water, it's causing your blood vessels to constrict. So that alternate dilation and constriction causes, it's a bit like a pump, I suppose, which increases blood flow to your limbs. So as you can see, we've listed the things there it does. Increases recovery, also decreases inflammation and swelling, and also decreases the severity of delayed onset muscle soreness. Best to do it after a heavy training session or after competition, but you obviously would not do it if you've got a recent injury, bruising, open wounds, if you're sick, or if you have a history of heart disease. Cryotherapy is sort of just one part of contrast water therapy, but this time, instead of contrasting, you're just subjecting your body to cold water. Has nothing to do with the name, but I just think if you're jumping into a bucket of ice water, it's going to make you want to cry. So that's how I remember cryotherapy. So once again, immersion is best. So a big ice bath would be fantastic. But if you don't have that, you could use a cold shower or a cold pack, like an ice pack. Cryotherapy does what the cold water does in contrast water therapy. It's going to cause vasoconstriction, which is actually going to decrease blood flow to your muscles. And the reason that can be handy is because the decreased blood flow would help decrease inflammation. So it's particularly good if you have got actually a soft tissue injury. This would be a good thing to do as soon as you can after performance. Cold also does reduce your perception of pain. And if you've been exercising where you've increased your core body temperature, being in the cold will help you get back to normal body temperature more quickly. When would you do it? After training, after competition, and as I said, particularly if you've got a soft tissue injury. So protocol would be a minute of cold water, 2 minutes out of the water, not in warm water, but just out of the water, and then back into the cold water again, and repeat that a number of times. Thermotherapy would be the funnest therapy to use, because you essentially just get to go and sit in a nice hot spa for a while. But it's actually, as a standalone therapy, not proven to be particularly effective. But if you do use it in conjunction with some other things, it does have its use. So if you subject your body to warm water, it's going to vasodilate your blood vessels and increase blood flow, and then you're going to get those benefits from having increased blood flow and the increased supply of oxygen to the working muscles, help you get rid of your waste products. The heat will actually help increase elasticity around your joints and help with your joint movement, and it helps you feel relaxed as well, because obviously it's pretty nice sitting in nice warm water. When would you do it? It's important that you actually wouldn't use heat as a therapy within the first 72 hours of finishing competition. So for your first 72 hours, you're better off picking something like cryotherapy or contrast water therapy. If you apply heat therapy too early, you can actually increase inflammation, which is going to be negative for your body. As I said before, not a lot of evidence to support that it's that beneficial by itself, and you definitely should not use it immediately after exercise, because it will elevate your core body temperature. So if you finish exercise and you're already pretty hot, the last thing you want to do for your recovery is prolong the time it takes your body to get back to normal resting temperature. Pool or beach sessions are pretty popular, particularly with team sports. You see a lot now when you watch the news after the weekend, after the footy rounds are finished. They do often show some footage of one of the teams walking around in Port Phillip Bay. So with pool or beach sessions, essentially what you're doing is you're using water to apply a bit of a hydrostatic pressure to your body, which is essentially acting as a form of compression. So the water's not cold enough to have the effect of cryotherapy, and it's obviously not warm enough to have the effect of thermotherapy. It is very much the compression element that's having the effect. So by having your body exposed to compression, you actually do increase blood flow though. So we say it creates an inward and upward displacement of your body fluid towards the center of your body, which results in a compressive effect. By having that compressive effect, it does help reduce swelling and reducing oxygen delivery to the muscles. Can increase your blood flow, and also good for feeling more relaxed, reducing your level of perceived exertion. If a beach is available, we do say it's better, because the buoyancy of the beach will create a better compressive effect. Also, if you were doing a beach or a pool session, it'd generally be guided, so you're not just standing there looking out at the sky. You would be doing stretching as well, and then the benefits of stretching in your recovery would be combined with the benefits of that compressive effect. So compression garments, it's very much the age of active wear at the moment. Everyone you see, whether it's in our PE class on a Monday afternoon, Tim, or somebody playing footy on the weekend or whatever sport it is, people love pulling out the active wear and the 2XU compression garments. So is it actually beneficial? It is and it isn't, I suppose. So firstly, compression garments have actually been around for a fair while. They just haven't been used in sport as popularly as what they have been in recent years, but certainly the medical field has been using them for a long time. So it's not uncommon for somebody to have a medical procedure and then sort of be scribed to wear a compressive garment on their leg or their arm or even their face or their chest. So they do have their role, and because they are applying a compressive effect to the body, that will increase blood flow and help speed up recovery. Though the sports ones that we use, because there's different grades of compression garments, the ones that are sold as sports garments are classified as mildly therapeutic. They don't actually apply as much compression as what the medical ones do. So how does it enhance recovery? So as I said, it applies a compressive effect to the body, which helps increase venous blood flow, so your venous return. That in turn will help increase blood flow and oxygen delivery to your muscles, along with nutrients, removal of waste products, venous pooling reduced, much like an active recovery does the same thing, reduction of swelling, severity of DOMS, and an increased perceived recovery rate. And our next topic is sports psychology, and you can never underestimate or discount the effect that actually perception has on recovery as well. When would you use it? This is the big thing, because everybody these days wears it whilst they're playing sport. There's actually no evidence whatsoever to suggest that it helps improve recovery, or even helps improve performance as you're wearing it, maybe a small psychological element. So if you're going to wear it, you would do it after training or after a competition. Its benefits are in the recovery phase. Alone, not as effective, so a combination of some of those hydrotherapy techniques we talked about, and then wearing your compression garments in between that would probably be the most beneficial thing to do. But as I said before, no evidence that wearing them during training or competition actually improves performance. Our next recovery strategy is a pretty cool one. Not so accessible to the everyday amateur athlete, but certainly used in various elite sports. So it's a hyperbaric oxygen chamber that's being used to elicit hyperbaric oxygen therapy. So if you break that word down, it's therapy using oxygen, hyper meaning a lot. So we've essentially made this little chamber that's got a heap of oxygen in it. So you've got a small chamber like this one down on the bottom left. It's been constructed to withstand pretty high internal pressures, so about 2 to 3 times more pressure impacting on it than what we would get on our bodies at sea level. And then inside the chamber, they've pressurized it with 100% oxygen. So in the air that we normally breathe in, we've got about 21% oxygen in that air. So 100% oxygen inside your oxygen chamber. So with the increased pressure in there and the increased amount of oxygen, it actually creates a situation where you dissolve more oxygen into your blood plasma, which therefore means you've got more oxygen available to get transported to your body tissues, and help speed up recovery. So in doing so, you're going to see a lot of our normal things we've talked about already: reduced swelling, stimulating new blood vessels to grow, shortens the length of an inflammatory response, helps prevent infection, and actually enhances sleeping patterns. And one of our next things we're going to talk about is how effective sleeping is. It's actually, no matter all of the things we've just talked about and how much scientific research has gone into them, sleeping is actually still the best. When would you apply hyperbaric oxygen therapy? After competition, and definitely it's used mostly if somebody's acquired an injury, so that it will help speed up the recovery. You guys have heard it a million times how important sleep is, And nobody's lying when they tell you how important sleep is. I know it can be hard to get a good night's sleep when you spend every day just thinking about how well you want to do on your PE exam and wanting to spend all of your extra spare time just getting ready for it. But sleep is still important, and as I said earlier, it's still regarded as the best recovery strategy that is available, despite all of those other things we just talked about. Why is sleep so good? It's pretty much the only time where your body is at complete rest, physiologically, but also psychologically. So your whole body's resting. And a lot of good stuff happens while you're sleeping. Your body's repairing and growing while you're sleeping. Not related to sport, but even related to just school and learning. You know, if you're spending hours and hours learning stuff each day, but you're not sleeping long enough, you're actually not giving your body the time it needs to really consolidate that information and store it in your memory. So whatever your routine is, make sure you get 7 to 9 hours sleep in it somehow every night. So sleeping helps grow and rejuvenate particularly your immune system, your nervous system, your muscular system, and your skeletal system, all of which are really important in sport. Exactly why it does all of those things is still a little bit unclear, but consequences that come about from having a lack of sleep are pretty well studied and quite clear. Things such as decreased focus, slower rate of processing information, impaired functioning of your immune system, so more likely to get sick, a bit more unstable in your emotions, a bit more irritable, memory function is reduced, and you just feel more tired, feel more fatigued, and you can't perform at a high level if you feel fatigued. Best applied nightly, obviously. So 7 to 9 hours a night is recommended. So if you're doing less than that, you really want to have a think about your routine to be doing more like that. And they do say, much to your disgust I'm sure, having a routine sleep pattern is beneficial, because even breaking from your sleep pattern for a few days can affect performance. So that sort of means roughly going to bed at the same time each night and roughly getting up at the same time each day. That is correct, even on a weekend. Sleeping in a dark environment, always preferable, so get the night lights off. 18 degrees Celsius, a bit harder to maintain that unless you're sleeping in a room with an aircon, but that's a good sleeping temperature. Shouldn't go to sleep within 2 to 4 hours of having a heavy or a high fat meal, so we generally call that dinner. For a good night's sleep, think about not drinking too much, not just alcohol, but even water, but particularly alcohol and caffeine. Caffeine will keep you awake. Alcohol will make you want to go to the bathroom and also does affect your sleep. Drinking too much water is going to make you want to go to the bathroom through the night as well. Other dot points interesting. Consumption of high GI foods prior to sleep may reduce the time taken to fall asleep. So, not a nutritionist, but when I read that, I just think bowl of ice cream before bed now is justified. Last recovery strategy. Looking at all of these, personally I'd love to just combine sleep with massage. I think that'd go alright, maybe a hot spa as well. But massage in its own right is a pretty popular recovery strategy. A lot of people making money off sports massages at the moment for sure. Not seeing too many sporting teams that don't actually use them, though the research is quite limited about their effects. We all know what massage is. You're manipulating the soft tissues of your body by applying a manual force. So there's a heap of anecdotal evidence, which means evidence that's not particularly credible, but there's not a lot of scientific support for how effective massage is in enhancing performance. Of that anecdotal evidence that is out there, most of the benefits are as followed. So increased blood flow, removal of waste products, decreased muscle tension, increased sense of well-being, decreased perception of fatigue, range of motion in your joints, muscle stiffness, anxiety decreases, reduced DOMS, reduced swelling. So claims to do a lot of things. Just be wary that there's not a lot of evidence to support that it does any of those things. When would you do it? In the recovery phase is best, so more beneficial after performance opposed to during performance. Though I do know, a lot of teams where massage is used pre-game as well. Also would be useful after heavy training days, after competition, or between race days.